Alone, it's back to school time all across the Hudson Valley, and for the first time since the pandemic, we are seeing relaxed COVID restrictions in our classrooms this year. But as News 12's Samantha Crawford finds out, for some parents, there are still concerns when it comes to their kids' health.
With schools heading back in session, Hudson Valley parents are hoping for this.
Just that we have a school year with not too much COVID drama again.
As COVID restrictions ease up in our schools, some parents say they're concerned about other viruses like polio and monkeypox.
They are contagious.
Yeah.
You know what I mean? So it could catch anyone.
To put your mind at ease, we asked the experts. Infectious disease doctor Sandra Cash says if your children are vaccinated for polio, you can relax.
For children who are immunocompromised or who can't get vaccinated for other reasons, they should take extra measures in coordination with their pediatrician to ensure that they limit their exposure risk.
She says you should also take those steps if your children haven't completed their polio vaccination series. When it comes to monkeypox, only children with rare immunodeficiencies can get the vaccine right now, but the CDC says kids do have a low risk of contracting the virus. However, health professionals say, of course, there is the chance for transmission in school through direct contact with the infectious rash, scabs, or body fluids.
It is a scenario that we do worry about.
What do schools need to do? I assume they can't afford to just sit on the sidelines here.
They can't sit on the sidelines. There needs to be education, awareness, consistent enforcement of school policies and procedures.
We listen to the experts.
Dr. Eric Byrne, the superintendent of Rye Schools and the president of the council representing all 78 public school districts in Westchester, Putnam, Dutchess, and Rockland counties, says they're prepared to keep kids safe.
We've made changes to how we clean buildings, how we filter air. There's been tremendous investment in heating and ventilation systems, changes in filtration, the use of outdoor spaces. So to me, those kinds of practices that helped us navigate the pandemic are going to help us continue to navigate future public health issues.
Based on guidance from health officials right now, Dr. Byrne is not overly concerned about outbreaks of polio or monkeypox in schools.
The reality is that New York State has had a pretty robust immunization requirement for many years.
But COVID shots are not required. At last check, over 70% of 12 to 17-year-olds are vaccinated in the Mid-Hudson region, but less than 40% of 5 to 11-year-olds.
What's your advice to parents that you could help keep your students healthy so you don't have to have a major pivot in the middle of the school year?
It's keeping those lines of communications open. So if your child is sick, call the nurse, have a conversation about it. Don't send your children to school sick.
Parents hope families listen.
Try to stay safe at every cost.
So it can feel like a truly normal school year. For News 12, I'm Samantha Crawford.
A back-to-school health checklist for you on our website, news12.com, and on our app with everything you need to know before the first day of school with guides to keep your kids healthy and ready to learn for the upcoming school year.